So, dear friends, it's me, Dr. Rajiv Srivastava, once again. I have come for you people, especially this time for our medical students. Now, for passing their exam, one of the very important aspect is the surgical case presentation. You all medical students know very well that it's a bit difficult task than appearing for the theory examination. Because in theory examination, sometimes you take a liberty, you can write whatever you want. But in the surgical case presentation, you are facing your examiner and you have to be very careful because your each and every movement, your each and every word what you speak holds there and can affect your marks. So I'm bringing here today is one a very important topic is surgical case presentation. Now we see that I will tell you some important tricks how to clear your surgical case presentation. Generally, in your practical session, you have short cases or the long cases. The surgery cases divided in two. Now, first and foremost important thing is that you have to be very well prepared about your subject. You should know very well about the subject. Then only you can analyze it. Then only you can Then only you will be able to reach particular diagnosis. Unless and otherwise it becomes very difficult. So I will just give you a few important tips, important tips how to present yourself and how to do a case presentation in surgery practical examination. Now, during surgical case presentation, before that I would like to tell that there is more knowledge you have about your subject, more easily you will be able to speak over there. So you should have adequate knowledge about your subject, and in my coming up videos I will take nearly all very important cases related to the surgery and give you full explanation of it, and we will discuss how to do this case presentation. So, as in any other department, the surgical case presentation goes with a very important topic, that is first is introduction. Now, this introduction is you are introducing your patient to the examiner. So, when you reach the patient in your examination hall, first have a few words exchange with your patients. Try to make your patient as comfortable as you can, and the important thing is once your patient is comfortable and he has got a proper tuning with you, he will be able to express yourself. So when you go to the examination hall, you get the patient, don't just start jump on your topic and or try to put your hand over the findings which you might have been told by your other colleagues. Be patient, be comfortable. First, introduce yourself to the patient. I am so and so doctor. Then you take introduction of the patient. In the introduction section, you ask about the name of the patient, sex, age, patient's address, patient religion, patient occupation, and the date of admission and date of examination. Now, this thing is very important. When the patient was admitted, date of admission, when the patient is being examined, because might be when the patient was admitted, patient had got so many different findings. Now, at the time when you are examining the patient, the findings might have lost, or finding might have changed. So, date of admission and date of examination is very important. I generally, when I take I find that student miss this part, but this part is very important. Then, once you have given proper introduction of the patient, then you go for as the present complaint. What are the chief complaint or the present complaint? Now, these are the complaint with which the patient has presented to you first time in the hospital. Now, the patient at a time may have many symptoms, but you have to write this symptom in the chronological order. The symptom which appeared first, you have to write it before. The symptom which has appeared later, you have to write it later on. Then don't try to club two symptoms at a time, like the patient is having pain, abdomen and vomiting since last 2 months. Don't like this. You give because each symptom has got its important relevance. So you have to tell each and every symptom in the proper manner. So you have to write the symptom in a chronological manner, like pain abdomen since 4 months, vomiting since 2 months, or lump in abdomen since 7 months. So we are writing the symptom in a very chronological manner. So try to incorporate all these symptoms, and this should be in the wording of the patient. Now next we go to the history of present illness. HOPI. This is history of present illness, and what I believe, this is one of the very most important section of any case presentation. If you are very good at history of present illness, take it for granted that you have cleared your examination. But if you have messed up your history of present illness, the chances of passing of examination will be very, very big. So give more and more time to the history of present illness. In the history of present illness, what we have written in the chief complaint, in the chronological manner, we have to describe each and every complaint. Now in this particular video, I am not going to discuss about the each complaint, how you have to take it. That I will take in my later videos. But in history of present illness, and now another important thing what I always used to tell my student is, history of present illness is like inverted pyramid. Now in the history of present illness, you should have say 4 to 5 diagnoses in your mind. This is the example. Then as you go proceed for your case, you should reach for 4 to 3 diagnoses, then 3 to 2 diagnoses, and finally you should have one good diagnosis with you. Now this should be the thing. If you have got more and more number of the provisional diagnosis in history of present illness, this will tell you how broad you can think about the case. And if you have got, restrict yourself to just 1 or 2 diagnosis in history of present illness, definitely it will create problem for you in a later part of the history. So history of present illness, you have full elaboration. Now what important thing you have to take in history of present illness is what disease the patient is having at present. I mean, what sign and symptom the patient is having at present, what probable thing would have caused these sign and symptoms to the patient, and if you leave it like that, and if the disease progresses, what further thing this particular disease can cause. So the 3 important thing is, what is the present sign and symptoms, what these present and sign and symptoms are, could be probably due to, and if left over, what these sign and symptom can cause. If you elaborate these things in history of present illness, that will be enough for you. Okay, so this is the history of present illness. Next is important thing, we go for past history. So what history the patient had been suffering in his past life. Now might be patient is suffering from some chronic disease like diabetes, hypertension, or tuberculosis. Might be patient has undergone some surgery, or might be patient has got this particular similar complaint some 2 to 3 years before. So all these things you have to take in a past history. If diabetes, hypertension, TB is not present, just write there is no history of diabetes, hypertension, or tuberculosis. Next we come to personal history. Now in this personal history, we try to elaborate what is a living status of the patient. Whether patient is alcoholic or non-alcoholic, smoker or non-smoker, tobacco chewer or non-tobacco chewer, vegetarian or a non-vegetarian, and some idea about his personal life, how he is carrying himself. So this thing is come into the personal life. The next comes is a family history. Now there are few diseases which have got a relevance in the condition of the patient. There's few diseases which runs in the family. So in that case, the family history is very important. And never ever say that there is no significant family history. Always try to say, right, the patient, the condition of the status of the patient, father, mother, brother. You write about the condition of them, and if they have already expired, then and then try to tell the what particular disease and what was the reason they have expired. So this thing you have to mention in the family history. And in the case of the female, next very important is you have to write about the obstetric history. Say obs history. In obstetric history, you have to write when the patient has attained the menarche, if the patient attains the menopause, what did the patient has attain the menopause, what if the patient was married, and how many children has the patient has, and how many sisters the patient has. Everything about the obstetric history, whether delivery was normal or the delivery was not normal. Everything about the about the children and about the menstrual history, you have to elaborate in obstetric history of the patient. Then is the drug history. What treatment is being taken by the patient is very important. Whether the patient is taking any drug for this particular disease or has been taking any drug, say the patient is a diabetic, what particular drug he is taking, or if the patient is allergic to any drug, then you have to note it down and you have to mention in your case sheet the patient is allergic to all these drugs. So this is the drug history. Then any other treatment history what the patient has taken before. No, treatment history related to present signs and symptoms or any other disease the patient had been suffering before. Say the patient had suffered from the jaundice some 6 to 7 years back. Then you have to mention that when this jaundice was there, what was the diagnosis, and what particular treatment the patient has taken to get cured from the jaundice. Now next is very important aspect. We come on the general physical examination. The general physical examination is a very important aspect in